I'm Dr. T. Trivikram, consultant physician in TX Hospital, Uppal. Today I'm discussing about diabetic diet, which is very, very important. See, diabetic diet means it is systematic, programmed, limited diet. It is very simple, okay? There is no much confusion. There is no need to do extra workup in your brain to have a specific diet. The diet is very simple. Systematic diet means usually when you are a non-diabetic person, you can eat whenever you want, you can eat whatever you want, wherever you want. But when you become a diabetic patient, there is a systematic diet. What is systematic diet? First thing is you have to eat according to the time. That is 8 to 9 is the breakfast, 12 to 2 is the lunch, 5 to 6 is the snack, and 8 to 9 is the dinner. So that is the first thing. In between these diet plans, timings, you should not have anything. Only water is the only thing which is allowed. That is the first thing. Before 8 a.m. you should not have anything. After 9 p.m. you should not have anything. And in between you should not have anything. Second thing, that is systematic diet. Second thing is programmed. That is specific to the time. You should have a specific time-bound food. The medications what have been prepared are prepared in such a way that you have to eat 3 times a day with evening 5 to 6 a small snack. Because there is a time lag between when you have your lunch at 1 o'clock and when you are having your dinner at 8:30, there is almost 7 to 7.5 hours of gap. And whenever you are taking anti-diabetic drugs, it is not good to have a gap of 7 to 8 hours in between. If you have a small snack in between 5 to 6, it may help you to avoid the hypoglycemic episodes. And it is very important where the patients are on high doses of insulin or high doses of oral anti-diabetic drugs. Next, limited diet. What we should have? Morning 8 to 9, that is breakfast, you should avoid all the rice items in the morning breakfast. You can have any tiffin, that is idli, upma, vada, in a limited quantity which is sufficient for you. And always you remember, you keep 20% of your stomach empty. That is enough. Whatever you eat as much as you leave 20% food which is don't eat your stomach full. You reduce it by 20%. Okay. Then comes, you can eat any tiffin or idli, dosa, vada, puri, anything you want. And mostly it is better you avoid oil content in your breakfast. Lunch. Usually you can have your rice, that is not stomach full, which is 20%. You keep your stomach empty and you have your lunch, rice with whatever curries you have. Next, 5 to 6 snack is very important. You can have one fruit. That is the most common fruits. What you can take is apple, pomegranate, mosambi, kiwi, dragon fruit, guava, papaya, and a piece of watermelon can be taken. With 1 glass of milk, with the protein powder, which is important in every diabetic patient, as they have nephropathy and they may have hypoalbuminemia, they may lose weight because of uncontrolled sugars. So protein is very important. A diabetic protein powder with 1 glass of milk and 1 fruit is very much allowed as a snack in evening, with biscuits like Marigold or something like which does not have any cream in it, can be taken with evening tea or coffee between 5 to 6. And the last comes is a dinner. Dinner usually you can take like morning 1 plate of tiffin of whatever tiffin you like, or 3 roti with the curry. This is the basic diet. This is the minimum diet what every human should have. You cannot tiffin, rice, this small snack and tiffin, rice, small snack and roti. You can't reduce the minimum basic nutrition what your body needs. This is the basic planned limited diet for the patient on anti-diabetic drugs or insulin, and avoid all the high glycemic index foods, that is sweets, chocolates or all other things, and avoid all other foods which I have not mentioned. So this type of program diet is enough for every diabetic patient and to take appropriate medication. See, this is very important for the patient to have the appropriate medication for the treating of his or her diabetes. This minimum amount of diet is also very important. If you don't take at least this much of diet, what I have said, we can't treat you, because whatever the medication what we give will become more than what is needed and you go into hypoglycemia. So I have to give you the treatment how much you require. For the treatment how much I have to give, you have to eat in an appropriate way. If you eat very less, I can't give you appropriate treatment. If you eat at least a limited, a specific diet, then only we can give you the treatment. And drink lot of water. Hydration is very much important. First thing. Second thing, avoid coconut water and sugarcane juice. Next, very important, what all the fruits what I have mentioned in the evening 5 to 6, you have to take it as a fruit, but not as your fruit juice. So it has to be taken as a fruit. And this non-vegetarian, egg white can be taken every day, and fish also can be taken every day, but chicken weekly once and mutton monthly once can be taken. Usually this oil-based fries has to be avoided in non-vegetarian, and the pieces which are cooked as a curries, you can take it in the pieces form, and the gravy has to be avoided. Next comes this vegetables. In vegetables, sweet potato has to be avoided, and beetroot, carrot can be taken every day, no problem. There is nothing, and it is more helpful for you. So one time rice, a meal a day is more appropriate than avoiding the total rice. Even carbohydrate is important for your health, even fat is important for your health, even protein is important for your health. You can't avoid it totally. Okay. So systematic program diet is important for every diabetic patient, and don't try to starve your stomach by not eating anything or eating very, very less. Okay. And that may cause gastritis and irregular bowel habits and acid peptic disease and gastritis. So eat timely, program and limited diet, and sufficient diet what you need. Thank you.